Welcome to our exploration of histopathological approaches in cancer diagnosis. Histopathology, the microscopic examination of tissue samples, is a cornerstone in modern cancer detection and management. By analyzing tissue architecture and cellular details, pathologists can identify abnormal growths and distinguish between benign and malignant lesions. This process not only confirms the presence of cancer, but also provides crucial information about its type and state. In this video, we'll journey through the essential steps and techniques that make histopathology an indispensable tool in the fight against cancer. Let's begin by understanding what histopathology truly means and why it's so vital in clinical practice. First step in histopathological diagnosis is obtaining a tissue sample. This can be done through various methods such as biopsy, surgical excision, or fine needle aspiration. Each technique is chosen based on the location and nature of the suspected tumor. For instance, a core needle biopsy is often used for breast lumps, while endoscopic biopsies are common for gastrointestinal lesions. Proper sampling ensures that enough tissue is collected for accurate analysis, minimizing the risk of misdiagnosis. Once the sample is obtained, it's carefully preserved to maintain cellular integrity for further examination. After collection, tissue samples undergo fixation, typically using formalin to preserve their structure and prevent decay. This step is critical because it locks cellular components in place, allowing for detailed microscopic analysis later. The fixed tissue is then processed through dehydration, clearing, and embedding in paraffin wax. This creates a solid block that can be sliced into ultra-thin sections. These sections are then mounted on glass slides, ready for staining and examination. Each step in this process is meticulously performed to ensure the highest quality results for diagnosis. Staining is a pivotal part of histopathology. The most common stain, hematoxylin and eosin H&E, highlights cell nuclei and cytoplasm, making it easier to spot abnormalities. Special stains such as immunohistochemistry can detect specific proteins or markers that help identify cancer subtypes. These techniques provide additional layers of information, guiding oncologists in choosing the most effective treatment. The choice of stain depends on the suspected cancer type and the information needed for diagnosis. On stain, the tissue slides are examined under a microscope by a pathologist. This is where the expertise of the pathologist comes into play. They assess the architecture of the tissue, the appearance of individual cells, and the presence of any abnormal features. Key indicators such as cell size, shape, and organization help determine whether the tissue is benign or malignant. The pathologist's findings are documented in a detailed report, forming the basis for the patient's diagnosis and subsequent treatment plan. Immunohistochemistry, or IHC, is a specialized staining method that uses antibodies to detect specific proteins in tissue samples. This technique is especially valuable in cancer diagnosis, as it can identify tumor origin and subtype by highlighting unique molecular markers. For example, IHC can distinguish between different types of lymphomas or confirm the presence of hormone receptors in breast cancer. By providing molecular-level detail, IHC enhances the precision of histopathological diagnosis and supports personalized treatment strategies. After thorough examination, the pathologist compiles a comprehensive report. This document includes descriptions of the tissue's appearance, the type and grade of cancer, and any relevant molecular findings. Clear communication between the pathologist and the treating physician is essential to ensure the patient receives the most appropriate care. The report often guides further diagnostic tests or immediate treatment decisions, making accuracy and clarity in reporting paramount. Despite its strengths, histopathology faces several challenges. Sampling errors, poor fixation, or inadequate staining can lead to inconclusive or incorrect diagnoses. Additionally, some tumors may mimic benign conditions, making interpretation difficult. Advances in digital pathology and artificial intelligence are helping to address these issues, offering new tools for more accurate and efficient analysis. Continuous training and quality control are also vital to maintaining high standards in histopathological diagnosis. The field of histopathology is rapidly evolving. Digital imaging, machine learning, and molecular diagnostics are transforming how tissue samples are analyzed and interpreted. These innovations promise faster, more accurate diagnoses and open the door to personalized cancer treatments. As technology advances, the collaboration between pathologists, oncologists, and researchers will become even more crucial. Ultimately, these developments aim to improve patient outcomes and bring us closer to a future where cancer is detected earlier and treated more effectively.